Hi everyone. I wanted to do just a short video reviewing some of the major topics in our therapy section. Also, sort of as a chance to tell you what we're doing to wrap up and say thanks for the semester, I guess. So let's get started with the lecture stuff first. There's nothing new in these notes that isn't in your PowerPoint slides that I already handed out. In fact, they're a little bit shorter and less detailed than those slides. So think of this as just a supplement. It shouldn't have anything new, but it might just be a different way of presenting it. So that might be helpful, a little more like our traditional lecture. Okay, so let's get started. So we're covering this idea of how we treat psychological disorders. It's a really nice follow-up to our last section that we just covered. There are two major camps or fields of therapy that fall under the therapeutic treatments for disorders. One of these areas is talk therapy, and we're going to talk about a couple different kinds of popular talk therapies. We of course call them talk therapy because if you're doing this kind of therapy, you're interacting with a trained therapist and you are talking about something, right? That's why we call it talk therapy. You're talking with a therapist about something or other. The other major kind of therapy is biomedical therapy. This is where you're using drugs or other procedures to directly act on the nervous system. The most popular biomedical therapies by far are drugs. Now, you don't have to choose between one or the other. There are plenty of people who are experiencing therapy for psychological disorders that are doing both talk therapy and biomedical therapy. So it's not a one or the other. You can just do talk therapy. Not many people recommend just doing biomedical therapy, just doing drugs. At least they recommend that you're checking in with a therapist regularly so you can make sure that the dosage is right, it's still doing what you want it to do. Do you need to shift to another drug or increase or decrease the amount? So not many people would recommend just doing biomedical therapy, period. Plenty of people just do talk therapy. Plenty of people do both. Plenty of people start with both and then ease off the drugs as they're finding new tools or techniques that they can use through talk therapy. Okay, let's focus on talk therapy first, a little bit more in detail. There are multiple kinds of talk therapies. Talk therapy tends to be broken down into two more classes or classifications: insight therapies and non-insight therapies. People who are doing some kind of insight style talk therapy, most common are psychoanalysis or humanistic therapies. They're called insight therapies because the thinking is they work by discovering insights about yourself, making connections between previous experiences and what you're doing now, basically as a tool to help you through the future by better understanding your past. So you're getting insight into your past. On the other hand, behavior therapies are more about, or all other non-insight therapies basically say, well, it doesn't really matter why you're experiencing what you're experiencing. It doesn't really matter why you're having the thoughts, feelings, or behaviors you're having. We're just going to focus on changing the unwanted ones. So you're not looking for some insight into why they happen. Basically, you're just going to focus on the fact that they do happen and how do we stop them. Okay, so let's talk a little bit about insight therapies first. One of the more familiar ones or common ones is psychoanalysis and psychodynamic therapies. Psychoanalysis, we just barely touched on at the beginning of the semester because this is what Freud started. Freud's technique is called psychoanalysis. What Freud would do with his patients is they would sit and they would talk. He believed that a patient's free associations, just saying whatever comes to their mind, their resistances, their dreams, their transferences between therapist and client, all of this stuff and the way the therapist interprets it is what will help release those previously repressed feelings, allowing the patient to gain some self-insight. Remember, Freud was all about this idea that we all have these repressed secret desires, wants, feelings that we can't admit to our own selves. We bury them, but they can still impact our behavior. So he felt that if you take a long time with a therapist, eventually these can be revealed, and by revealing them or bringing them to the surface, they stop causing those same psychological problems. That's Freud's way of doing psychoanalysis. Major problems with Freud, we don't buy a lot of what he said. This stuff about all these repressed secret desires and stuff. Yeah, we don't really use any of that. But his technique of psychoanalysis had some problems as well. If you were one of Freud's patients, you were going to meet with him 2 or 3 times a week. Your sessions with him would be 90 to 120 minutes, so an hour and a half, 2 hours long, 2 or 3 times a week. And he would say you would expect that you'd need to do this for multiple years in a row minimum. This is very expensive, very time consuming, and really slow to see any progress. So it wasn't very practical. Only the elite, the richest people who had plenty of time on their hands could even do this kind of psychoanalysis. Most of us, it would have been out of our reach. Now, psychoanalysis is not fully gone. We have modern psychoanalysis. With modern psychoanalysis, the goal is to help people understand their current symptoms and to explore and gain perspective on previous thoughts and feelings that led to those symptoms. They still involve client-centered face-to-face meetings, and some talk about the past relationship troubles, relationship with family, siblings, what growing up was like, early romantic relationships, if you're having trouble with current ones. You're still going back and looking in on the past, but you're not necessarily pulling apart some kind of secret desires. It's just the idea that maybe past behavior can tell us something about present behavior. You can get some insight into why you do the things you do based on what you've experienced throughout your life. It's not trying to dig into any kind of secrets. It is quicker. The idea with modern psychoanalysis is really within a few months, you should be getting some sense of how your past is influencing your present. A little more practical. It's not supposed to go on forever. You're seeing a therapist, I don't know, once a week, once every other week, more like 50-minute sessions, not 2 or 3 hours long sessions. So it's supposed to be a bit quicker. It's less mysterious. It really is a little more straightforward, but it still does rely on this idea of coming to some kind of insight to help understand why you do what you do as part of the process of feeling and getting better. The other big kind of talk therapy is behavior therapy. Behavior therapy is one of those non-insight therapies. What you're doing here is you're going to say, we don't care why you do what you do. We're going to instead apply learning principles to eliminate unwanted behavior. So unlike psychoanalysis, you're not focusing on inner cause of behavior. You don't care so much what the cause is. Instead, you're going to focus on outcome. How can we change the thing you don't want to do? Behavior therapy, we're going back to things we learned back when we talked about learning. Remember, classical conditioning, operant conditioning. Well, how do we learn patterns of behavior, and how do we unlearn them if they're an unwanted or undesired pattern of behavior? One example of a behavior therapy technique that's pretty common is called exposure therapy, and exposure therapy is often used in treating phobias. In fact, it's very successful at treating phobias. If you were a client who had a phobia, let's say a fear of spiders, it's not too uncommon, and you were going to do exposure therapy with your therapist, they would gradually expose you to greater and greater fearful stimuli. This is why it's called exposure therapy. You're exposing the person to the thing they're afraid of. But you do it in careful measures. If someone had a phobia of spiders, first session, you would just maybe talk about spiders. What's scary about them? Second session, you might think a little more about spiders, imagine the spiders. Once the client is able to handle that, you might look at still photos of spiders, right? Once they're able to handle looking at a still image of a spider, the next session you might watch a video of spiders. Each of these successive therapeutic interactions, we're getting a little closer to the thing they're really afraid of, right? A real live spider. But we're taking our time getting there, and the therapist is going to use techniques to help the client manage their stress, manage their anxiety, feel comfortable and like they're able to handle the situation before they would move on to a greater level of exposure. Notice we're not talking so much about why you have this fear of spiders. We're just saying we're going to use some conditioning to get you less afraid of the spider. We're going to change your behavior. Another example of a very popular non-insight therapy is called cognitive therapy. We had behavior therapy, now we have cognitive therapy. Cognitive therapy is focusing on patterns of thought or cognition. The goal is to change from less healthy to healthier patterns of thought. So when we talked about depression, we said that one of the things we've seen is that people who tend towards depression have certain ways of thinking about difficult or tragic events. They have this global, lasting thought pattern that I'm never going to be happy again, everything in my life is ruined, all is bad, and it's all my fault. A cognitive therapist would say, there's other ways to approach this. How about we practice when something bad happens, thinking about it as, this is temporary, it will pass. How about we focus on thinking about all the other parts of our life that haven't changed, that are still really good? Trying to change thought patterns or cognition. And this is just habit. It can be a hard habit to develop, but you can change your thought patterns, the way you think about and approach different problems. And that's what cognitive therapy is going to try and do. A lot of therapists combine behavior therapy and cognitive therapy. The most common non-insight therapy is called CBT, which stands for Cognitive Behavioral Therapy. We just put those two pieces together. If you are a client doing cognitive behavioral therapy, you are working on changing your thought patterns or cognition, and also working on changing your behavioral responses to things, changing your behavior. It's really common for therapists to do these two together. So if you're dealing with depression, maybe you're going to work with your therapist on changing your thought patterns when something goes bad. How can I think about it as being temporary, more specific, as opposed to global and long-lasting? And I'm also going to do certain behaviors differently. When I'm feeling sad or blue, instead of just retreating to my bed where I'm going to sleep all day, which is my natural inclination, I'm going to force myself to behave differently. Maybe I'm going to force myself, even if it's short, to go outside and take a couple-minute walk around the block. Because research has shown that sunlight can improve mood and moving can improve mood a little bit, not a lot. But if we're making little behavioral changes, while we're also trying to change thought patterns, we are doing cognitive behavioral work. We're kind of working at both sides at once. Now, all of these talk therapies are not exclusive of each other. You might be doing cognitive therapy and behavioral therapy with a little bit of psychoanalysis, a little bit of, and why do you think you tend to have these depressive patterns? Why did you start thinking about bad things as though they last forever? Can we understand your reason why you got to this place? Because for some people, maybe knowing that can help them change the thought patterns, change the behavior. Therapists don't necessarily just do one of these things. They kind of treat them like different tools in a tool belt, and they're going to pull out different ones depending on the client and depending on the particular psychological disorder. So you don't have to pick just one, although one might tend to suit you more than another one if you're the client, and one technique might suit you more than another if you're a therapist. You might just be a little better or a little more skilled at one way of approaching problems than another. One might come to you a little more naturally or feel like a better fit for you. It's not to say one is more accepted than the other. All of these are considered very appropriate kinds of talk therapy. And remember, we call all of the ones we've talked about so far talk therapy because regardless of whether you're trying to get at some past insight, you're trying to change thought patterns, trying to change behavior, all of them are done by talking between a therapist and a client. That's why we're calling these talk therapy. Let's talk for a minute about biomedical therapies, which are not talk therapy. These include physical, medical, and other forms of biological therapies. So a few things fit into this. Most common kind of biomedical therapy by a lot is called psychopharmacology, or psychopharmacology is the study of drugs that affect psychology, right? That's where the psycho part comes. Pharmacology is drugs, psychology. So the most common biomedical therapy is going to be some kind of drug treatment for psychological disorder. Some psychological disorders are very effectively treated through drugs. Some are not. Some psychological disorders tend to require some level of medication for treatment, others don't. If you are doing psychopharmacology, if you're taking drugs for a psychological disorder, that doesn't mean you're definitely not also doing talk therapy. You could be doing both. Although it's the most common, drug treatment is not the only kind of biomedical therapy. Another kind is psychosurgery. Psychosurgery, of course, involves surgery. It most common would remove or destroy brain tissue in an effort to change behavior. Psychosurgery tends to be irreversible, partly because it's irreversible, partly because we're messing directly with the brain. This is the least used biomedical therapy. A probably more familiar example of a psychosurgery is the lobotomy, which is the destruction of a particular part of the frontal lobe. This was a psychosurgical procedure used to calm uncontrollably emotional or violent patients at one point in time. It's a procedure that, when done, I'm going to say, quote, correctly, even though we would say it's never good to use it anymore. But when it was done in the past correctly, the psychosurgeon was cutting the nerves connecting the frontal lobes to the emotion controlling centers of the inner brain. This one, though, could go really badly wrong, resulting in basically a vegetative state or death. This one has major consequences. As you can imagine, if you're messing around with parts of your brain and damaging parts of them, it can do a lot of stuff. This is not light fine tuning of anything. This one is not used anymore in the United States. Another more modern psychosurgery that's, I'm not going to say it's becoming common, but I think people are taking more interest in it, even in just the last 5 years, is something called deep brain stimulation. Deep brain stimulation is still very controversial. It is still very new, so we don't fully know that much about it yet, but it is a neurosurgical procedure that involves the placement of a medical device called a neurostimulator. And this neurostimulator, also sometimes called a brain pacemaker, but typically it's called a neurostimulator. It sends electrical impulses through those implanted electrodes to specific regions of the brain. The hope is that, now notice, we're not damaging intentionally a part of the brain, we're not removing a part of the brain. Instead, we're adding a device that can cause small amounts of stimulation to certain particular parts of the brain. The hope is that certain disorders, movement disorders like Parkinson's disease or tremors, could help be controlled by deep brain stimulation. There's also some clinical trials to see whether it could be useful for epilepsy. There's a couple others as well. Chronic pain, major depression, obsessive compulsive disorder. Notice we're talking about disorders that are kind of all over the map. They're not the same kind of thing. Some of these may not pan out. We might find deep brain stimulation doesn't do anything. In other cases, this is a very serious medical procedure. We might decide that the potential dangers could outweigh the potential benefits. Not sure. We're still pretty early on in this research, I would say, to decide for sure whether it's going to be incredibly helpful for all these conditions or not. Finally, I wanted to mention electroconvulsive therapy, or ECT. This is another kind of brain stimulation, but this one does not involve implanting anything into the brain. You are simply putting electrodes on the outside of the head, outside of the brain. This one actually has an interesting history. It used to be used in much the same way a lobotomy was. So it was to control patients who were behaviorally out of control. It went very far out of favor because it really was done in a way as almost a punishment for, quote, badly behaved people, as opposed to any kind of obvious therapy. It would kind of stun people into, close to a vegetative state, much more controllable state, but it wasn't well controlled. It has seen a bit of a resurgence in use, still not common, but it is being used in some cases of people. Now, though, it's being used for some people who have severe depression. This is the kind of depression where they've tried talk therapy, they've tried lots of drugs, they've tried other kinds of therapies, and it's not working. These tend to be people who are regularly suicidal, who just have such deep, deep, deep depression that they are desperate for anything because life just does not feel worth living with the level of depression they have. For some clients like this, they've tried electroconvulsive therapy, which does involve sending an electrical current through the body. We don't know how it works. This is one of the reasons that this one's pretty controversial, is because we have seen major positive effects in some people, as in the next day, their whole body language is different. They're sitting upright. They're talking differently. Not just the words they use, but they're speaking louder, clearer, faster. They don't sound exhausted, which is how they were sounding before they had this treatment. Their depression was so heavy. Their mood, of course, major change, even within a couple of days of having this, even within a couple of hours in some cases of having this electric shock. Some scientists who use it describe it as being like a reboot to the system, right? Like you would with a computer. But that's not really how our brains are set up to be, quote, rebooted. And it certainly does send this wave of electrical activity through the neurons in your brain. But why that lifts mood, we don't know. It's also not a permanent fix. A lot of people who do this will say within a year to 3 years, their mood has dropped again. And in some cases, they've done electroconvulsive therapy again. We're not sure the long-term consequences of this, which is another reason why doctors don't love it. They like to know what are the side effects. And this one, it's not as clear. We don't really know how it works. We're not sure why it works for as long as it does, why it stops working. We don't know if you do it again, if it's going to last for shorter times each time, or if it could have long-term damage. But for some clients who've done it, they've said, look, the alternative is death because nothing else works. And that's how deep this depression is. So I'm going to go with it as long as it works. So those are a couple of the kinds of biomedical therapies. Like I said, the use of psychoactive drugs, usually drugs that mimic or influence our neurotransmitters in some way, are by far the most common biomedical therapy. It is very common to mix biomedical and talk therapy. Either permanently or temporarily use a biomedical therapy while you're developing good tools and techniques to change your behaviors, change your thought patterns, stuff like that. Okay, so that's what we got on therapy. This is our last topic for the class. So once you're done with this, you're done with the new stuff. Remember, we do have a cumulative final in this class. I will put together a very short study guide just on this talk therapy stuff. On this therapy stuff. There's not a lot there, but I'll put something together. Use that along with the study guides for the first 3 exams because this exam is going to be cumulative. We'll still have our exam on our same planned day. I believe it's the Monday of finals week. So we'll still have it on that same day, but just like with exam 3, I'll make it available for the full 24 hours for you to take. Once I know how long the test is, I will know how long you have to take it. It'll be another timed test, but I haven't made it yet, so I'm not quite sure how long it'll be. But I'll let you know, and I'll keep you posted through announcements. If you have questions, you can email me. If you want to just talk through something, we can do a Zoom meeting. If you'd like to meet with some other students virtually to do some reviewing and studying for the exam, but you don't know how to coordinate that, send me an email. I can send out a request. I can kind of try to put you in contact with other students who want to do that sort of thing. Tell me what you need to help me facilitate the last end of our class. Thanks for sticking through this change in class with me. I'm hoping it wasn't too incredibly painful. I miss seeing you guys. I miss having class. It was always nice to have some discussion in here, so I do miss that. But I'm hoping you're doing okay, and I'm hoping you feel like you got something out of this class and learned a little bit that you can share with others and, I don't know, help you live your best life. I'm suddenly Oprah, apparently. But yeah, hope you're all doing really well. And if you need anything from me, please let me know. Take care.